Recognize the solution. For healthcare systems and medical practices that persistently avoid CCM or treat it like a side project, there seems to be no relief on the horizon. For these practices, providers and clinical support staff will continue to do busy work that could be automated, and Medicare patients with multiple chronic conditions will have their needs met less frequently and in a manner that is not reimbursed. According to a 2021 article in the New England Journal of Medicine discussing the potential of virtual care where clinical staff can support the work of healthcare providers, virtual care may be less productive if every interaction is still one-on-one with a physician. Clear delegation of responsibilities with regard to which tasks are delegated to technology and which are delegated to clinicians is important. Supporting patients between office visits with clinician-backed technology works. Do not duplicate efforts or require clinicians to click more boxes. A CCM program deployed effectively offers a framework for such delegation. What is the price of inaction? Driven by scarcity, healthcare systems and medical practices are consolidating at higher rates. At the same time, patients that are claimed by healthcare systems and medical practice for the purposes of Medicare reimbursement cannot then be claimed by another medical practice. The result is something like a land grab to get patients into systems, including CCM programs, before competitors do. With greater incentives for CCM coming, this competition only promises to become more fierce. Therefore, practices that are to thrive in the coming years must have a sense of urgency to get new technologies in place. If not, they are at risk of losing reimbursement to direct and indirect competition. For every 500 patients who might otherwise be enrolled in CCM, the price of inaction is $26,700 in monthly reimbursement. Now is the time to act on building a better, empowered practice for Medicare patients with multiple chronic conditions. This has been shown to be up to 75% of specialized practices. Surviving post-COVID, essential. The reality is that in one way or another, all healthcare systems and medical practices were negatively affected by COVID. Unfortunately, patients who are eligible for CCM have been the most prone to die from COVID. Heart disease, diabetes, cancer, chronic obstructive pulmonary disease, chronic kidney disease, and obesity are all conditions that increase the risk for severe illness from COVID-19. This is from the CDC. And then for those with multiple chronic conditions who survive the pandemic, the need for improved quality of care is essential to their very survival. Adopting a more proactive approach that leverages the combination of technology and healthcare workers to improve outcomes means so much. Improve care management to these vulnerable populations at a time when they need it most. There are technology solutions that can increase interactions 10 times from 3 times a year to 30, while actually reducing the busy work of those caring for them. During the pandemic, non-essential procedures were suspended for extended periods, eliminating reimbursement for many specialty care practices. Meanwhile, many specialists with internal medicine residencies went to the front lines to face the pandemic head-on, adding another source of traumatic stress to the financial burden. Even with federal aid available, healthcare systems and medical practices were dealt a major financial blow by reduced visits, according to the American Medical Association. 81% of physicians surveyed in July and August of 2020 said revenue was still lower than pre-pandemic. The average drop in revenue was 32%. In-person patient visits are down. Healthcare providers are in need of relief from a seemingly endless procession of misfortunes due to the pandemic. According to the CDC, 4 in 10 adults surveyed reported delaying or avoiding routine or emergent medical care because of the pandemic. The results of delayed routine care and screening have also been disastrous. Decreases in screening have resulted in the diagnosis of fewer cancers and precancers, and modeling studies have estimated that delayed screening and treatment for breast and colorectal cancer could result in almost 10,000 preventable deaths in the United States. Even as visits have rebounded to near pre-pandemic levels, lasting consequences are expected to continue, including an increased emphasis on telemedicine, where reimbursement is diminished. There is reason to hope, however. Recent advancements in technology have paved the way for better and more effective chronic care options. These technologies, including artificial intelligence, AI, can facilitate better outcomes and higher quality of care for all Medicare patients, especially those with multiple chronic conditions. Experienced providers of CCM programs are essential to such an approach. With a trustworthy partner to implement new best practices and automations at scale, the CCM population can be kept in contact more frequently and more effectively than is possible with legacy processes, such as the EMR and calling. So CCM has been shown to increase engagements with patients by tenfold, identify and close 6+ care gaps per patient per year, cut emergency visits by up to 5%, drive 95% patient satisfaction, and deliver $320,000 in reimbursement per 500 patients enrolled per year.